Hello, this is Dr. Mark Lebwohl. I'm the Waldman Chair of Dermatology at the Icahn School of Medicine at Mount Sinai in New York. I will be discussing efficacy and safety of Ixekizumab for the treatment of moderate to severe plaque psoriasis. Results through 108 weeks of a randomized phase 3 clinical trial called UNCOVER-3 were presented by Dr. Andy Blauvelt and colleagues at the American Academy of Dermatology annual meeting in Orlando that took place from March 3rd to March 7th in 2017. To summarize the poster, the efficacy of Ixekizumab was maintained over 2 years of treatment, showing high rates of skin clearance in patients with moderate to severe plaque psoriasis. The safety profile of Ixekizumab was comparable to shorter treatment periods. This study is important because since long-term treatment is usually required to maintain adequate disease control for moderate to severe plaque psoriasis, the long-term efficacy and safety demonstrated in this study are reassuring. Now let's discuss study design. UNCOVER-3 was a randomized, double-blind, multi-center phase 3 clinical trial of Ixekizumab. Patients were randomized 2 to 1 to receive either Ixekizumab, 80 milligrams every 2 or 4 weeks, etanercept, 50 milligrams twice weekly, or placebo for 12 weeks. The Ixekizumab patients received a loading dose of 160 milligrams. At week 12, patients entered an open-label extension phase. Patients continued on or were switched to Ixekizumab 80 milligrams every 4 weeks to complete a total of 108 weeks of treatment. Etanercept patients had a 4-week washout period from weeks 12 to 16. At week 60, patients could increase their dose of Ixekizumab to 80 milligrams every 2 weeks at the investigator's discretion. And here are the key findings. 1,346 patients were randomized. At baseline, the mean psoriasis duration was 18.1 years. PASI score was 20.9, and the percentage of body surface area involved was 3%. At week 12, a PASI 75 score was achieved in approximately 90% of Ixekizumab patients, compared with 55% of etanercept patients and less than 10% of placebo patients. By week 36, more than 90% of patients in each of the 4 groups achieved PASI 75. The rate remained stable through week 108. In patients originally randomized to Ixekizumab every 2 weeks, then switched to every 4 weeks, 80% achieved a PASI 90 score at week 108, and 56% achieved a PASI 100. Not a dot of psoriasis left. Following week 60, 3.8% of all patients increased the Ixekizumab dose to 80 milligrams every 2 weeks, although the majority had a PASI 75 score. Increasing the dose had little effect on the overall efficacy analysis. 84 to 85% of patients experienced one or more treatment-emergent adverse events. Most were mild or moderate in severity. Nasopharyngitis was the most frequent adverse event, occurring in 23.5% of all patients combined, and upper respiratory tract infection or injection site reaction each occurred in 7.5%. So the conclusion of the study was that over 2 years, Ixekizumab showed maintenance of efficacy in every endpoint that was looked at, and there was a very high rate of skin clearance. Only 3.8% of all patients increased the Ixekizumab dose to every 2 weeks after week 60, and even those that chose to increase to that every 2-week dosage, the majority had PASI scores above 75 at the time that they increased that dosage. The safety profile over the 108 weeks was comparable to the shorter term treatment safety profile. So overall, excellent maintenance of efficacy and very good safety for the 108 weeks.